Okay, this is Tippy. She's an 18-year-old Pomchi, and we are going to do her cranial sacral therapy. To start out with the observation, if you look at her face, it does not go in a straight line. It is kind of shifted a little. It could be from her dental issues, or it could be from trauma, but it's not a perfect parallel line. Also, when she walks, her gait kind of leans more to the left. I'm sorry, Tippy. So she was a good candidate for cranial sacral therapy to help her body realign itself. So we're going to start with the Atlas release. And since she's a small dog, I only got to use 2 to 3 fingers. Then we will slowly move down to the cervical, where I will have my fingers on the TPS and the SPS, and we will move from C2 to C7, feeling for her flow. Hang on, Tips. There doesn't seem to be any disruptions in her flow, so we'll keep moving down. Hang on, Tippy. Then we'll get to her shoulders. On the top and the bottom scapula is the shoulder release. There is a little bit of tension, so I'll have to stay on here a little bit longer. Till you feel her release, which could be a sigh or a lick or just a small kind of breath. Then we'll move down to the thoracic, and I will have to have one hand under and one hand above. I know, I'm sorry. Hang on. Doesn't seem to be a whole lot of tension there, but I'll stay a little longer. Then we'll move down from the thoracic to the lumbar, which I'll have to have one hand under where her belly is and her teats, and then one up top. There is a little tension. I'll have to stay here a little longer until she releases. And when she releases, I'll have to move down to the sacrum, which is a little bit above the tail. Her flow seems pretty good there. And then we'll do some leg unwinding. Hang on, Tippy. I know, I'm sorry. Hang on. Hang on, Tippy. Hang on. I know. Then we'll do the other leg, same way. I know, I'm sorry. Hang on, a little longer. Wait. I gotta do your back legs. Then we'll do the back legs. She doesn't like this one so much. She kind of fights me a little bit. Hang on, Tippy. There's just a little bit of pressure, not much. And you just wait for the release. The other leg. Hang on, hang on, hang on. I know, I'm sorry. We do the same with the other leg. Hang on, Tippy. There we go. And then we just wait for the release. Hang on a little longer. Then I gotta do the tail unwinding, which she does not like at all. And it is one finger because she's small on the bottom and your thumb on the top. Gentle pressure. And we just wait for the release. And we'll do the TMJ release because she does have dental issues. So I will have to put a finger on the side of her mouth in here and then one on the other side. With a little bit of pressure. Oh no, I know it's weird. And that was the release. Then we're going to do the cranial bone adjustments, which I will start with the parietal. And since she's small, I only have to use 2 fingers. And then you kind of imagine the bones just coming together and aligning themselves. And I have to feel for her palpitations. So right now it's a little tense. And I gotta wait for her to kind of relax a little bit. Then from the parietal bone sutures, we'll move to the frontal, which will be up here. Again, I don't have to use my whole hand because she's small. And you just imagine the bones coming together, realigning themselves. And from the frontal bones, we will move to her lacrimal, which is just right under her eye. She doesn't really like this one. Hang on, Tippy, I know. I gotta do this on both sides. And just wait for her palpitations to be in a more relaxed state. Good. And we do, I know, I gotta do the other side. Hang on, hang on. And we do it again on the other side. Hang on, Tippy, I know. And then from the lacrimal, we'll do the nasal. Since she's small, I can use one hand. And just right here on each side. And picture it just realigning itself, helping the flow go in the right direction. And then finally we will do the maxilla bone, which is feel like your jawbone basically. And we will apply a little bit of pressure. Visualize her bones going where they're supposed to be so her body just flows naturally. We're just waiting for release. And that is it.